But now we're going to look at the other options, which are called over-dentures, and these are different types of teeth that snap into implants. So it's still technically a denture, but it's vastly different in that when it goes in, it doesn't just sit on your gums and cause pressure, it actually snaps into place. And it's very rigid, and there's much less acrylic and bulk to it. So here's a situation where we had 4 implants, but she didn't have them spaced out in the right areas to have screwed in teeth. So these are actually dentures, but they're locked into place very naturally. One of the other things that we can do, the dentures are held into place, we can make the teeth more natural looking. One of the reasons dentures look like dentures sometimes is that they have to be made short, because if you don't have, you just don't have enough grip for your denture. So if you make the teeth shorter and smaller, well, there's less leverage, so the teeth just don't move around as much. And when we have good solid anchors, we can make the teeth like this, where they look like natural teeth, and they're nice and long, and they look and feel just much more like natural teeth. So this is an upper denture, and this is what they look like, the little snap attachments. These are just little titanium place, and you just brush them, and then the denture has little snaps on them that go into that, and that's what that looks like. Those little parts. That's an upper denture. A conventional upper denture would actually have all the plastic in the middle that covers the roof of the mouth, and that's a big benefit as far as taste and function. Upper jaw is a little softer, so we always have to put in 4 implants. But the lower jaw, because it is a little stronger and denser, we can sometimes get away with just 2 implants or to hold in a denture. And once again, there's another good example of a denture before that was stained and discolored and worn, and the teeth were very short because they couldn't be made the natural length, and then we were able to build them back up. Here's another example. Once again, she had a denture before implants, and there's her denture after the implants, and a good example of how it supports your face and smile also. Okay, so just kind of comparing the two, over-dentures versus bridges. The over-denture does require more maintenance because you're taking it out, in and out every day, so the parts wear out. Whereas the fixed bridge just stays in, except for every 1 to 2 years we take it out. So the teeth on a denture are more like a natural or regular denture. They're basically acrylic. Sometimes they're hardened ceramic, but they do wear down more as opposed to the zirconia or the other materials we use with the bridges.